The next section of our talk is going to talk about antipsychotic medication for patients with borderline personality disorder. And we'll review a study by Black from 2014, which I think highlights some of the strengths and weaknesses of the research. So these researchers studied quetiapine extended release versus placebo in a randomized controlled trial for borderline personality disorder. It was a large trial, 95 participants, and they compared 300 milligrams of quetiapine ER to 150 milligrams versus placebo. They found that the lower dose was more effective than placebo on borderline symptoms, which was the primary outcome, and it actually had an effect size that was in almost 0.8, which is quite meaningful. The moderate dose wasn't significantly better than placebo. There was no significant differences between the two doses themselves. On the secondary outcomes, which were things like physical and verbal aggression, both medication doses were superior. But as you might expect, this medication caused many side effects like sedation, and sedation was a reason that patients discontinued the trial. And the study had quite a few exclusions in terms of comorbid diagnoses, so it does make it limited in terms of generalizing to all clinical situations. But this study really highlights the points of the use of antipsychotics in patients with borderline personality disorder. They do have benefits. They can be particularly useful for anger, impulsivity, and aggression. And they do have some value for the cognitive perceptual disturbances, non-delusional paranoid ideation, or even some dissociative features. These medications can be useful when the patient is in distress and showing a lot of borderline symptoms. Then to work collaboratively with the patient to use low-dose antipsychotics and have them use them for a period of time, maybe 2 or 3 months, and then have them taper and stop the medication. And they may see this as a tool they can use in the future if they're really struggling with their symptoms. There's a very interesting study that was using large databases looking at exposure to clozapine in patients who were diagnosed with borderline personality disorder. And on the basis of large data sets, they were able to show that clozapine may have a role in decreasing self-harm and suicide overdosing behavior. The use of antipsychotics in patients with borderline personality disorder can be particularly useful for anger, impulsivity, and aggression, and they do have some value for the cognitive perceptual disturbances. And of course, you do have to remember the many side effects of antipsychotic medication, particularly weight gain, sedation, that can limit their usefulness with these patients.